Morning, morning everybody. Morning Steph and Martin. It's not too bad in Birmingham at the moment, so thankfully. Sorry, it's not so good in London. Definitely winter coming. Yeah, definitely got that feel. Have scraping ice off the car. Welcome back. So we did the muscles of respiration last time, looking at the diaphragm, the scalenes, the intercostal muscles, and finished off the ligaments as well. Looked at the ligaments of the ribs and the thoracic spine. So now we are going on to muscles of the thorax. So we're going to have a look at the muscles that attach to the thoracic region. So kind of like around the collarbone to the bottom ribs, basically. So that's where we're looking at. I'm going to kind of divide it up into sections and have a look at each of those sections. Good morning, Tris. Good to see you as well, mate. Cool. Yeah, it looks like we've got a few in live this morning, which is good. Right, so let's get going. We're going to have a look at the muscles on the back first of all. Yeah, so these are muscles that are posterior muscles, but then attach onto the thoracic spine. So let me just get rid of that. So a couple of things to go over. So a few words that you're going to see. If you've never seen these muscles before, then these are really, really useful terms because it explains why the muscles are called what they are. So we've got serratus, which means serrated, like a serrated edge, like a knife edge, like a bread knife rather than a normal knife. And then latissimus means broad, and then dorsi is dorsum, which means back. So we've got a broad back muscle, and then we've got deltoid, which means a triangle type shape. Okay, delta, basically from the Greek delta. So we've got a few names of muscles that are named after shapes, and that will help you when you're having a look at these muscles and why they're given such big long names. First one, straight into it, and just move me up there, is your trapezius muscle. So this one definitely attaches to the thoracic spine, but it also attaches right up into the cervical spine as well, up into the neck and into the skull. So your occipital bone, we haven't covered that yet, but that's the kind of back of your skull. So if you feel the back of your skull, you can feel the bony bits, and then there's soft tissue underneath. So that ridge that you can feel, the kind of last bit of the skull, that's your occipital ridge. And then we've got the spines of C7, and then all the thoracic vertebra, so T1 down to T12. So it covers the whole thoracic spine, which we've been obviously looking at over the last couple of weeks. We've got another attachment as well on the clavicle, so the collarbone, the acromion, and again we haven't really covered these because we've not gone up to the shoulder yet, but these are areas on the shoulder blade, the scapula. So we've got the acromion and the spine of the scapula, so we'll have a look at what that is. The clavicle is your collarbone. Okay, so there's an attachment of this muscle onto the collarbone as well. So you can see from the broad nature of this muscle that it has an effect on the head, on the neck, on the shoulder, and on the thoracic spine. Okay, so because of where it attaches, it can influence all of those areas. We've got fibers that go down. So this bit here is the spine of the scapula. So from the spine of the scapula down, you can see the direction of the fibers. So those are your lower fibers. Then we've got fibers that come across. Okay, so directly across into this mid portion here. So those are the mid fibers, and then the upper fibers are coming up this way. Okay, so it's kind of split into three regions. So UF, which is upper fibers, MF middle fibers, LF lower fibers. Okay, so that's what those mean. So you can see the upper fibers will elevate the shoulder girdle. Okay, so they'll bring your shoulders up towards your head. So it depends on which bit you keep still. So if you keep your head still, then the trapezius muscle at the top will lift your shoulder up towards your ear. Okay, so like a kind of shrug movement. But if you keep your shoulder still and then that muscle contracts, then your head will move. Okay, so it depends on what bit you keep still as to which bit moves. Then we've got the middle fibers. So these will retract the scapula, so bringing the shoulder blades back together. And then LF, it will so the lower fibers will depress the scapula. So after it's elevated, it will help to bring it back down again. Obviously, gravity will do that as well. But if you're lying on your back, there's no gravity to help, so those muscles will bring your shoulder girdle downwards. And you can kind of like further depress the shoulder girdle from its normal resting position usually. Okay, so wherever your shoulders are, you can kind of squeeze your shoulder blades down even further. Okay, so that's the kind of action that the lower fibers will do. And then the upper fibers and the lower fibers and the mid fibers really as well, to be fair, they will rotate this shoulder blade, so they rotate the scapula and stabilize it through movement. So when your shoulder moves and you bring your arm up to the side, your shoulder blade has to move as well. Well, it will at a certain point. And then what you'll get is the trapezius muscle. Some fibers will be contracting, some fibers will be lengthening as that shoulder blade then moves with the arm. Okay, so again, depending on which bit you keep still, it depends on what happens with the movement. So if you bring your arm forward and across your body, then that's going to elongate more the middle fibers. And then if you bring your arm up from there, then the shoulder blade has to move. So then the upper and lower fibers are going to kick in as well. So there's a lot going on with this trapezius muscle. Okay, it's quite an important one. Let's have a look at it. Hopefully this is the right one. Better than last week. That was a nightmare. Everything went well this week. Okay, so let's just pause that there. So this is the picture that we've just seen on the PowerPoint. Just move me out of the way. This is the table that you've just seen on the PowerPoint, giving all the actions. And then this is it on a cadaveric model. So you can see, obviously, it's not as clean cut as it is here because there's lots of other muscles. So we've had the skin taken away. We've had the superficial fascia taken away and all the fat tissue. And then this is the first layer that you'll come to. You can see these, see the white area here? So this is more sort of tendinous tissue as it attaches onto the spinous processes of the thoracic spine just there. So there's your TX is basically means thoracic spine. CX is shorthand for cervical. Okay, so cervical spine up here, thoracic spine here. And then see here as well, this is quite white, this tissue all around here. So we've got more kind of tendon tissue, or more sort of collagenous tissue around here as well. And then the darker stuff in the middle, that's all the muscle tissue or the muscle fibers. Okay, so you can see the upper fibers coming up to the neck, the mid fibers coming across to the upper part of your thoracic spine, and then the lower fibers coming down here. And you can just make out the outline of the shoulder blade. So that's it there. Okay, so that's the pointy bit. Well, nearly see it right at the bottom there. And then these muscle fibers here, these are your deltoid in your shoulder. Okay, so just to give you a bit of an orientation as to where everything is. So yeah, that's the spine of the scapula just there. There's your collarbone at the front. So middle fibers here, upper fibers up here, lower fibers down here, and then there's the spine of the scapula. So that's it just there. So that's your attachment point for the trapezius. So you can see it's all the way up onto the base of your skull, all the way down these spinous processes. There's a specific bit of tissue that kind of fills that gap in the neck, and we'll talk about that when we get to it, but it attaches onto there, and then all the way down to T12. Okay, so on the spinous processes of every single thoracic vertebra. And then this bit here, this is where it attaches onto the shoulder blade, and then just around the edge there onto the very end of the collarbone. Okay, so your clavicle. So you've got the scapula, which is your shoulder blade, and that bit there is called the spine of the scapula because it's raised up, it's elevated. so that, yeah, it will go all the way from there and then across onto these points and then down. Okay, just pop that there. Here we go. So that's the spine of the scapula, and then right onto the end of your clavicle just there. So that's it, kind of overlaid. And you can see the fiber direction. So remember the ligament we were talking about, supraspinous ligament? That's what it attaches into. Okay. So this will be the attachment for the lower fibers, the end of it there. Here we go. So this is coming into retraction. So that will be more middle fibers doing that. And then upper fibers, elevation. And then there's no depression on that video, but you get the idea. Okay, so the when we have a look at the shoulder, we'll have a look a bit more at how the scapula moves. It's called upward and downward rotation. So we'll have a look at the trapezius involvement when we get to that. Cool. So that's your first one. And then we've got then two muscles kind of together, really. Just move me again. So these lay underneath your trapezius. So if you took the trapezius off, peeled it back, this is what you'll see underneath. So you'll see the rhomboid muscles. And we've got two. We've got a major one, which is the bigger one, and then a minor one, which we'll see in a second, which is just above it. And you'll see they're kind of joined, but there is a bit of a gap as well. So you could argue that they're kind of all one tissue, but they are separated in the anatomy books. But the gap is quite minimal, really, and they do the same thing as well. Okay, so we've got origin T2 to T5. It's the vertebral or medial border of the scapula is where it attaches. So on that border just there, okay, and these are your spinous processes of the thoracics just here. It will elevate and retract your scapula. So if you have a look at the fiber direction, muscles can obviously only contract. So when they contract and they shorten, they will elevate your shoulder girdle or assist in that movement anyway. And then they'll also retract the shoulder blade. Okay, so they'll bring your shoulders back. So very similar to those middle fibers of the trapezius. So that these will all work together. So let's have a look at your, in fact, let's do rhomboid minor as well while we're there. So the minor is just above it. So the major attaches just underneath here, and then the minor just above here. This area there, that on your shoulder blade again, that's called the superior angle. So it's just underneath that superior angle, and then attaches up into these cervical and thoracic vertebrae just here. So the base of your neck, and then the very top part of your thoracic spine. Okay, and again, the fiber direction is exactly the same as major, and it does exactly the same thing. Okay, so it will elevate and it will retract that shoulder blade or the scapula. Okay, let's have a look at that. Just get rid of those. Okay, here we go. So these are your rhomboids. So there's the last video that we saw. So the trapezius over the top. Okay, remember I said if we peel the trapezius away, then you'll see the rhomboids underneath. So at the moment you can't see them. There's the spine of the scapula. You can see the edge of the shoulder blade just there. See that little muscle poking out there? That looks as if it's the bottom of rhomboid major. Let's have a look when they take trapezius away. So this is all trapezius still. And then that's going to be removed. Here we go. So there's your rhomboid muscles there. So if I just pause that there. So there's the minor, that one there. And then there's the major, that one there. So they're I think they're a bit bigger than what you'd imagine them to be, because you see them in the pictures here, and they only look quite small. But these are pretty big muscles. We'll talk about that one when we get into the neck, because that one does a different kind of thing. So it's this one here, so the minor and then the major just there. And you can see that there is a bit of a separation but they're very, very close together. Okay, and they follow the same direction. They do pretty much the same thing. Okay, so rhomboid minor is above, rhomboid major is below. Let's just play the rest of this one out. Excuse me. So here we go. Here are the attachments on the shoulder blades, and then the attachments onto the thoracics as well. So C7, T1, and then T2 down to T5, roughly. Okay, it's going to differ a little bit from person to person. And then there's the attachment on the medial border. So again, elevation and retraction. So it's going to bring your shoulder blades back together and lift them up. So very, very similar to the action of your trapezius. Okay, especially those middle and upper fibers, because they follow the same kind of direction. Cool. And then big muscle. Okay, so we've got lat dorsi. Remember, latissimus means broad, dorsi means back. So but because of dorsum, so this is a broad, really broad back muscle, attaching down into the lumbar spine as well. So we have talked about this area here when we did the lumbars. This white area here is called the thoracolumbar fascia. So it's thoraco, which is thoracics, lumbar spine, and then fascia, which is a connective tissue. And it's kind of like a diamond shape of connective tissue in that lower part of your back, and that's where your lats will attach into. And across the other side is where the glute maximus will attach into. Okay, so we've got lower 6 thoracic vertebra, lower three quarters of the ribs. Okay, so lower ribs there. The thoracolumbar, well, on this bit is called aponeurosis, which means the same. And aponeurosis is basically like a broad, flat sheet. Okay, so it's either called thoracolumbar fascia or thoracolumbar aponeurosis, and they both mean the same thing. And then the posterior iliac crest, so around this area here. Okay, I've just seen a few questions. So tight traps could cause headaches. There is a kind of label given to headaches of a muscular origin, or it may be, well, musculoskeletal origin, called cervicogenic headaches. So tension with any of the muscles around the area that attach into the neck or into the head can bring about tension type headaches, so cervicogenic headaches. How about the so-called knots in the traps area? Are they fibrofatty tissue? Do you know what, those knots that people usually talk about are usually the superior angle of your scapula. Okay, usually they're bony, and people go, oh, I've got this real bad knot, and they usually do that. Okay, so they'll go there, and the knot that they can feel and the bit that's sore is the superior angle of the scapula. So if you muscles don't really have knots in them anyway, unless there's been an injury. But you'll have an increased sensitivity, let's say. Okay, so that an area that is it's just a sore spot basically in a muscle. Reasons for it, causes for it, we're not entirely sure. If you image it, if you scan it, MRI, CT, ultrasound, there's nothing there. So anatomically, and again, unless there's an injury there and there's scar tissue, there isn't anything there. You can't see it. So it is a perception. It is a sensation that people can feel. So that is more likely related to some kind of irritation to the nervous system. Okay, so it's either something to do with the tension, so the muscle's fatigued, and then when muscles get fatigued, they struggle to work properly. So one of the things that really helps that kind of feeling of tightness in the trapezius is strengthening them. Okay, so manual therapy and working through and loosening off everything feels good for maybe a day or two, but then and then it comes back. And if that's the case, if that is what is happening, then we need to look at why they're getting that kind of fatigue feeling in the first place. So you can have what's called a fatigue induced muscle soreness. Okay, so so if you're feeling it in the belly of the trapezius, then usually that's what it is. When people usually point to the knotty bit, it's usually the superior angle of the scapula. And I have known people who've come to me where somebody has tried to massage out this superior angle of the scapula, and they've been in agony, and it hasn't changed anything. I was like, well, it's because it's a bone, and you can't you can't rub that away, I'm afraid. So usually it's that that they feel. But yeah, if it's in the muscle belly, it's more likely to be either a DOMS problem, so a delayed onset muscle soreness from training, or if someone doesn't really exercise, that's obviously the problem as well. So you can get a fatigue-induced muscle soreness too. And sometimes there isn't a reason. It's just that's what's happened. And we don't really understand why. So we can try to give people more capacity by exercising these muscles and making them have better endurance, better muscular strength. But even then, sometimes that doesn't help either. So there may be something else going on too. So there's lots of reasons why people have pain, and sometimes it's related to the anatomy, and sometimes it's not. I hope that's helped. We do sometimes get these little fatty bits of tissue in the very surface of the skin. So lipomas, you can get lipomas, but they're if they haven't been diagnosed, then they need to be scanned, because any undiagnosed lump or bump is a red flag. So if it's that kind of thing, then they need to go to their GP to get that checked out. But yeah, the feeling of muscle tightness is a perception. Okay, so usually, unless they've obviously had an obvious injury. So let's have a look at the lats. Just switch these out. Here we go. Okay, so broad back. Here's your lat dorsi. Let me just pause that there. Okay, cool. So obviously that's the image that we've just seen on the slides. That's the table from the slides as well. This is the lat. Okay, it is huge, and it obviously attaches onto the arm, but comes all the way down into the lower back as well. So that's the lower part of trapezius just there. Excuse me, I knew that was coming. So there's your attachment on the iliac crest. There's the attachment on the ribs. Little bit on the inferior angle of the scapula as well, and then it attaches on the inside of your arm. Okay, so it's kind of like on the front bit of your arm, the intertubercular groove. So it twists underneath the humerus and joins in with teres major. So teres major is lat's little helper, right? And then there's the lat there twisting under. So it forms the back of the armpit, which is called the axilla. So you've got the latissimus dorsi at the back, and then the pec major at the front. And when you lift your arm and it forms the armpit, the back wall of your armpit is your lat dorsi, okay, and then the front wall of it is your pec major. So that's what forms your axilla region. So this is the action, one of the actions of the lat dorsi. So we've got extension of the arm, so it'll bring the arm down, and because of the twisting nature of it as well, it will also internally rotate the arm, and then it also brings about depression. So if you just play that again. So if your shoulder is elevated, it will help with depression. So already we've seen lower trapezius and lat dorsi both assisting with depression of the shoulder girdle. Okay, so there we go. Ribs attachment, inferior angle of the scapula. I'll just move me over here so I don't get in the way. And then remember, it twists underneath the humerus and attaches around near the front. Okay, so that's the edge of it there. You can see the edge of the line. Joining in with teres major, twisting under. And then there's the back of the armpit there. Okay, so it forms the back of the armpit. And then when it contracts and pulls down, it brings about extension. And then if it's elevated, it will help depress. Okay, cool. Just check for questions. Nope, we're all good. Okay, so those are your back muscles that attach into the thoracic spine, and obviously they're going off in different directions and attaching to other stuff as well. So when we get to the shoulder, we'll revisit the trapezius, and we'll revisit the rhomboids, and we'll revisit the lat dorsi, because they all have an effect on the shoulder movement as well, on shoulder movements as well. Yeah, not only do they stem from the thoracic region, but they also go off into other bits as well. So yeah, anterior muscles next. So muscles on the front, and we've got well, this is muscles of the thorax. So these attach onto the ribs, okay, and obviously the ribs make up the thorax. So we've got the pec major muscle at the front, and all of the stuff we were talking about over the last couple of weeks. So the sternum, the costal cartilage, up into the manubrium, yeah, so that those bits of the sternum, all of that area there is where the pec major will attach onto, okay. And again, we've got different fiber direction of the pec major, so it kind of fans out, and you can see that in this picture. So there's a bit of a twist to it again as it attaches onto the humerus, onto the arm bone, upper arm bone. And then you can see the fibers coming up this way, the clavicular fibers. Then we've got sternal fibers coming this way and then down this way. Okay, more costal fibers that way. Yeah, clavicular fibers flexes the arm, horizontally adducts the shoulder, so it brings the arm across the body. And then sternocostal fibers will extend a flexed arm against resistance. So if you're trying to like push downwards against an object, then those muscles will start to engage. So we've got a few different actions with the different fibers of the pec as well. Okay, let's have a look at pec major. So this bit, we'll just pause that there. So we've just had a look at the lats, which forms the back of the axilla, which is your armpit. And now we've got the pec major on the front of the thorax, which forms the front wall of your armpit. Okay, so and you can see that around here. Okay, that area there. So there's your collarbone, that's your clavicle. So you can see some of the attachments onto the clavicle just there. Then there's your sternum in that middle bit there, and then obviously these are your ribs here. And remember, ribs, the word for ribs is costal, well, it has costo in it, so either costal or costo, so that is a rib. So when we've got sternocosto fibers or sternocostal fibers, that means they attach from the sternum and the ribs. Okay, so let's have a look at this. So there's your pec major, there's the front of your armpit, yeah. There's the back of your armpit, so that's what we've just seen. So lat dorsi coming up into the humerus, and then the teres major, and then there's your pec major just there. Okay, so that's the axilla, which is your armpit. So the back is the lat, the front is your pec major. There's your clavicle attachment, and then it attaches to the manubrium all the way down the sternum, and then onto the costal cartilages of the ribs as well, and then there on your humerus. Okay, so when it contracts, it will adduct, so it'll bring the arm in towards the body. You'll also get internal rotation, So it'll spin your arm inwards, okay, as well as horizontal adduction. Yeah, so it does a few different actions. So that's your pec major. So that's another one that attaches onto the ribs in the sternum, which is part of your thorax. Obviously, it attaches to the arm as well. Then we've got pec minor. So this is similar to the organization of the trapezius and then the rhomboids underneath. What we've just looked at is the pec major, and now we've got the pec minor underneath. Okay, so this lies deep to the pec major, attaches onto the rib cage again, and then up onto the shoulder blade onto something called the coracoid process. So we'll look at that when we get to the shoulder. So pec minor looks like this. Okay, so there's the image that we've just seen. So there's your humerus, there's your clavicle, and that there, see that red area there, that's the pec minor muscle. So if I just pause that there, okay. So that bit there, that's your coracoid process. So it's a bit that sticks out from the shoulder blade at the back and it pokes out to the front. So we've got some muscles on the front that help stabilize and move your shoulder blade. Okay, this one here, this one will be either short head of biceps or coracobrachialis. Looks like coracobrachialis, that one. And then, yeah, we've got the attachment here on the coracoid from the pec minor. But you can see it's quite a broad muscle, yeah, all the way there. And the pec major will be covering this one. Yeah, so there's your coracoid, there's your pec minor. So ribs 2, 3, 4, sometimes down to 5. Depends which book you read. And then there's the coracoid just there. That's the attachment there. So from there to there. So you can see with the angle of the fibers, what it will do is it will bring the shoulder girdle forward. Okay, so we've got protraction and also depression. So again, that will bring the shoulder girdle down. So if you think about that, we've got lats, lower fibers of trapezius, and then around the front we've got pec minor that all help to depress the shoulder girdle. Okay, all of those working together. So not one of them just does it on its own. They all work as a team. Just show you that one again. So coracoid attachment on the ribs, and then because of the angle of the fiber direction, remember muscles can only contract. So if you pull that closer to these, you're going to get the shoulder blade coming around and down. Okay, so protraction and depression. Cool. So that's your pec minor. Okay, you might have heard me talk about this before. I did a bit of a study on pec minor about 15 years ago now, because I was interested in the anomalies of the body and the fact that some people have got some muscles and some people don't have them, or they attach in different places. Because obviously we've got the textbook of where things go from and to, but sometimes the textbook isn't always right. So this is something called Poland syndrome, where elements of the pec muscles just don't develop during the embryological stages. So one side does, but the other side doesn't for whatever reason. We don't really know why. Some kind of like insult at that specific time. And the I was going to say production, but that's not the right word. But when the pec is formed, there's a specific window. It's like literally on a day and an hour in the embryological development. And if something happens at that specific time, then it just doesn't happen. Okay, so the switch isn't switched basically. So or it will skip a switch. So if you imagine like, okay, let's go sternum, yep, check. Rhomboids, check. Deltoid, check. Pec minor, nah. And then pec major, maybe. And then lats, yep, check. And it's literally like that. So it basically, that bit, for whatever reason, doesn't get formed. and you end up with this anomaly. One of the things that I was interested in was that there was a study done where they looked at pec minor, and it didn't attach onto the coracoid, it attached straight into the shoulder capsule. So that would have changed the actions of that muscle because it's not attached to the bony landmark that it's supposed to be. So that's what kind of sparked my interest into this area. But there's lots of different anomalies like this, and that this person can function entirely normally, because other muscles will take over the job. Okay, and they'll just adapt, which is exactly what the human body is very good at doing. Okay. Cool. Last couple. So we've got this massive muscle, serratus anterior. Again, I think kind of in our minds, it's kind of like, oh yeah, it's just a little muscle. But this attaches onto the ribs. So again, it's a thoracic part of the thoracic region. And then it also attaches onto the inside of your shoulder blade. So it's really hard to see on this picture. I tried to get the best kind of angle, but the attachment point of it is on the edge of the medial border of the scapula. So when this muscle contracts, it drags your shoulder blade around the rib cage. Okay, so that's its role. Okay, it also has a role when the shoulder blade moves up and down. Okay, so that upward and downward rotation in conjunction with the trapezius. So trapezius and serratus are both working together, or should be. The interesting thing with this is that where the rhomboids come in and attach onto the medial border, and then serratus comes around the rib cage and attaches onto the medial border, they're basically continuous. It's like one continuous sling of muscles that move the shoulder blade around the thorax. Okay, so hopefully you'll be able to get that from this video. Let's have a look. Excuse me. So serratus anterior, serrated edge. Okay, so remember that. So it's like a serrated knife. Here we go. So there's your humerus. There's your collarbone. So your clavicle. All of this here. So that there. Can you see these muscles here and here? Huge, huge muscle. That is all serratus anterior. Yeah, huge, attaching onto the ribs that we've seen over the last couple of weeks. So all the way around there, and then there's your serrated edge, wraps around the ribs. This is actually a very good video. Look at that, perfect. Let me just take that back a little bit and pause it right there. Okay, so onto the front, the anterior part of the medial border of the scapula. So the inside edge of the shoulder blade, that's where your serratus anterior attaches onto. Okay, and remember what I was saying, the rhomboids attach onto the other end of it. So the rhomboids and serratus work together to guide that shoulder blade around the rib cage and move it around. There we go. That's a really good image. So there's all the attachments onto the ribs. They're really quite long muscles that come all the way around to the front, and then there's the attachment on that medial border there. Okay. Here we go. So that's what it does. Okay, so it helps to protract the shoulder girdle, but it will also bring about upward rotation as well. Here, is this going to show it? Yeah, so your shoulder blade kind of sits in a bed of muscles. Look at that. Shoulder blade on top of... Yep, so shoulder blades on top of the... do you mean intercostals or the ribs? Either way, it's on top of both. Yeah, so yes, you're right, whichever you meant. So yeah, let's just go back here. Yeah, so you can just about make out. There's the intercostals there. There's a rib. Yeah, so the intercostals are underneath serratus. So it's yeah, layers wise, intercostals and then serratus on top of that. Yeah, cool, perfect. I thought you did. Yeah, so intercostal muscles. Yeah, the serratus is on top of those, so superior to those. Yeah, so wrapping around the ribs onto the front of your shoulder blade. So there's all the rib attachments. And then there's the inside of your shoulder blade just there, medial border of the scapula. And then these are quite nice videos when we start to see the movements that serratus can do. So they're big muscles, they're just kind of gliding across the rib cage. Yeah, so if you pull on down on those lower serratus fibers, it's going to start to spin the shoulder blade, and then your lower fibers of trapezius will elongate as it spins, and then the upper fibers will contract as it's lifting the top part of the shoulder blade. So they're all working together to bring about that that movement and stabilization of the shoulder girdle. So yeah, your shoulder blade is basically in a sea of muscles. So that it's called the scapulothoracic joint, but it's not really a joint. It doesn't attach to the ribs, or doesn't attach, the scapula doesn't attach to the thorax. It sits in muscles, and then the muscles then move it around. Cool, where are we at for time? We are doing good. This is the last one, perfect. And then the last one we're going to have a look at on the front. It's supposed to be a heart introduction as well, but we'll start that next week. So this is a tiny little muscle, but important when you're looking at even movements of the shoulder. Okay, so this will attach from your first rib and costal cartilage, so that's why it's included in the thoracic muscles, to the middle third of the clavicle, and it stabilizes and rotates the clavicle. Okay, so it helps to spin the collarbone, and the spinning of the collarbone helps you move your arm, because if the collarbone doesn't move, then your arm will become somewhat like jammed. Yeah, so it'll get to a certain point, and unless the shoulder, clavicle can spin, you can't get that last bit of movement. So subclavius is really important for that. And this is what it looks like. Again, another muscle I think where you think is quite small. It is quite small compared to the others, but it's a bit bigger than you think, I think. So that's the image that we've just seen. There's your clavicle. There's your pec minor. Or some super slow-mo this. So there's the head of your humerus. It's quite good having it super slow-mo. Sternum just here, so you can see the ribs and the intercostal muscles. Now we're kind of looking underneath the collarbone. So subclavius, like a submarine, underneath the clavius, underneath the clavicle. Okay, so middle third of the clavicle down onto the first rib. So that's it, right under there. Okay, so if you're kind of feeling people's movements of their sternoclavicular joint and it just feels a little bit stiff, it might be the joint that's a bit restricted, but there may be maybe a reason to try to kind of, I don't want to say elongate. It's just kind of like release off, if you like, the subclavius muscle. Okay, so if there's some kind of tension around the subclavius, then you can use manual therapy to help reduce the tension in that muscle there. So it's right underneath there, and if you look, you can't really get access to the front, underneath the front bit of the clavicle. It's in that middle bit. Okay, so if you tuck your fingers right underneath there, but with the shoulder elevated, then you can get under there and use manual therapy to help improve the movement of that area. Okay, cool. That is us done. Get rid of that. Perfect. So that's the muscles of the thorax, looking at the ones on the front and the back, and that tidies up all the muscles that we're going to look at. So we looked at the muscles of respiration, muscles of the thorax, going on to the heart, and then we'll have a look at the lungs, so the viscera within the thoracic cavity. And just to let you know, if you're based in Scotland, hopefully, fingers crossed, this is really quite big news, to be honest, because it's never ever happened before. but we may have access to the anatomy labs in Glasgow University, and they do not allow private companies to use them usually, but because of the work we've been doing at King's College, then we're looking at putting on a cadaver day in Glasgow in March time next year. So if you are Scotland based, then it saves you travelling down to London. If you are England based and closer to the south, then we do have a July date for the next anatomy workshop. Is July 18th. So you can go to clinicalanatomy.education to have a look at those. Okay. See you in the next. See you next week at 10 o'clock Monday. See you then.